If you're worried about getting high blood pressure, or have already been diagnosed with high blood pressure, you may be wondering what symptoms to look out for. Because symptoms are not always clear, it is important to check your blood pressure regularly. When you're at your doctor's office or pharmacy, take a few minutes to put your arm in the cuff and take it. If you can afford it and actually want to use it, a home blood pressure monitor is a worthwhile investment. Now we'll tell you 5 acute signs that you have high blood pressure. Number 1. Chest pain. Chest pain should always be taken seriously, whether you suspect hypertension or not. Any chest pain should be investigated, whether it is excruciating and pressing or mild and intermittent. Never assume that chest pain is simply heartburn or indigestion. Chest pain can be a sign of many different serious conditions. Number 2. Knocking in your ears. If you have a pulsing or pounding sensation in your ears even though you're not exerting yourself much, it could indicate elevated blood pressure. It could also be related to too much caffeine, so try drinking less coffee and soda. Anxiety can have the same effect. Try meditation or a relaxing activity to see if the throbbing goes away. Number 3. Mental status change. This can be a difficult symptom because when we are confused, we may not be able to respond with proper judgment. It is important that the people who normally deal with you are able to recognize the signs of an altered mental state, confused thinking, altered speech, unusual behavior, and even just decreased activity. Besides high blood pressure, there are many other possible causes for this symptom, such as a stroke or an unreported head injury, so always seek medical attention if you notice changes in consciousness. Make sure family members know what to look for and that any sign of a rapid change in mental status is an emergency that requires immediate medical attention. Number 4. Severe headache. If you know you have high blood pressure and suddenly get a severe headache, you should see a doctor right away, especially if you haven't had a headache before or if your headache feels different from ones you've had in the past. Headaches are complicated. There are numerous possible causes such as caffeine withdrawal, sinus congestion, tension and stress. If you've never had a headache before and suddenly get a severe headache, you should see a doctor right away. And number 5, changes in vision. High blood pressure can affect the blood vessels in and to your eyes. If you notice a sudden change in your vision, blindness, loss of vision in one eye, change in part of your field of vision, or anything else, you should see a doctor. If a hypertension crisis is the cause, doctors will treat you with medications that lower your blood pressure and protect your vision. Do you still want to know what you should do every morning? Then watch the video which we link to you here. If you like the video, then I would be really happy about a thumbs up. And don't forget to subscribe to this channel and activate the bell so you don't miss any new video.